Hello, welcome to our presentation on the best use of Apteco software 2022. This presentation is from Health Education England and us here at DCX. So just to start, a very quick overview of the what we'll run through today. So who's presenting, a little bit about us here at DCX, a lot more about HEE, the partnership and how we work together, and then a view of the current landscape. What challenges were we facing? What did we deem as the appropriate solution for that? And then the all-important impact and results off the back of that. We're always looking for continuous improvement, so there's a little look towards what's next as well. So who's presenting today? So I'm Josh. I'm the account director here at DCX. I've been here for 4 or 5 years, and we've been working with Health Education England for the last 3 to 4 years, and we're very proud of the partnership that we have with them.
Hi everyone, my name's Darren Aldrich and I'm the Head of Communications for the NHS Health Careers Service at Health Education England. I've been working in recruitment, marketing and advertising for 15 years now, and it's something I'm incredibly passionate about because of the difference we make to patients and to the workforce.
So a quick intro into us here at DCX. We are a full-service digital marketing agency, and we combine the power of data with compelling creative digital technology to help brands connect better with their customers for better outcomes. We've got capabilities across the 5 pillars that you see here on screen today, covering strategy, consultancy, digital product and platforms, creative concepts, and content, and data and AI. And really, it's the data and the AI that really underpins the 5 pillars that you see there, and hopefully that will come across in this case study here today. But that is enough about us. I'll ask Darren to talk about the great work that they do there at HEE.
Thanks, Josh. Just a bit of an intro to Health Education England and what we do. So Health Education England is an NHS arm's length body. This basically means we work in partnership, primarily with central government to deliver their priorities. We also work very closely with our partners in the NHS locally and the education system, such as universities and further education colleges. This is our vision. In simple terms, this means we work with these partners to plan what workforce the NHS needs. We then recruit them, we train them and we educate them so that they are available to the NHS locally to deliver high quality patient care to the people of England. So in my role and in my team at HEE, we recruit the workforce. So we are an essential part of the NHS's recruitment strategy. And this is our model for delivering marketing campaigns and communications activity. The first phase of this is Inspire. We want to show people that the NHS is a world-class employer and the benefits of a career in the NHS, such as being able to make a difference to people's lives every single day. We want to show the range of career options there are in the NHS. If you ask many people, they will say when you ask them about a career in the NHS or a job in the NHS, they will mention doctors, nurses, maybe midwives, but actually there are over 350 different career options in the NHS. And we try to help people find the right one for them. We also try to challenge stereotypes. A lot of people still think that the vast majority, that nurses are women, when actually there are more men applying for nursing than ever before. The next phase in our model is Inform. We want to be able to offer people accurate, accessible and inclusive careers information that supports their career decisions. And by information, we mean such as the entry requirements needed, the qualifications, the skills, the experience you might need for a certain role. This allows them to make some informed career decisions about what they want to do next. And the final phase in our model is Action. And this is probably most important for the NHS workforce. We want to encourage people to take positive action to join the NHS. That could be applying for a course, it could be applying for a job, it could be applying for an apprenticeship.
So working in partnership. We're incredibly proud of the partnership that we have with Health Education England, and we've worked with them since 2018. It started with a We Are the NHS campaign, which really was to drive recruitment, of course, for nurses within the NHS, but also to try and drive some pride across the NHS. And it was a wide TV advert and other medias as well. And that was really enhanced by COVID as well. HE's existing data management, we were receiving data separately from a range of different sources, all of which we were collating, and they were very siloed at the time. We started to build different data capture forms to integrate this into one central place. But really what we were trying to build was triggered communications off the back of the data capture methods, highly targeted email communications to support in driving recruitment for the NHS. And that included various partnerships, including the one here with Mumsnet. As we started to work through that, we could see a real need forming for a single customer view to collate all of this data into one central location. There was multiple different data sources across different locations within different agencies, and really the visibility of that data was lacking at the time. So we scoped out and proposed developing a single customer view on HE's behalf, which really was to consolidate and utilise all of the data that was captured to drive better results within the email communications. The major asset that we have is the data. So how can we pull all of this information together to allow us to understand the users better and provide highly targeted communications to support the client's objectives?
So as Josh said, we have a very highly complex data architecture, as you can see here. And we had some real concerns around the multiple touch points capturing and storing of people's personal information. There was no single customer record, meaning that if someone potentially opted out of communications through one touch point, they may have a record elsewhere that could mean them continue to receive comms from us, which could lead to data breaches. This raised major concerns around the data governance and of us not breaching GDPR. This was solved by the SCV, but we still had concerns around the visibility of the data. We had no immediate access to our data, making campaign planning and reporting to senior management and partners onerous and sometimes very time consuming. Back to you, Josh.
So from there, as Darren's outlined, we had a challenge, and really it was then how can we find a solution? How can we better provide visibility and use this data to its full capacity? We'd been a trusted partner with Apteco for a number of years, and it seemed like a great solution to tick off a number of challenges that we'd identified as we worked together. So we looked to build Apteco over our single customer view, which loads on a nightly basis, and essentially pull together all of those different data capture sources to provide really targeted communications off the back of it. And since we've done that, we've started to really grow the database, and that's not directly as a result of Apteco, but that's really facilitated that change, and it's gone from around 1,800 to around or over 200,000 records at this point, which is great, and that's continuing to grow over time. So the next thing was the challenge.
So this is our typical year for HE in respect of our recruitment marketing, and it revolves around the UCAS cycle for applications to undergraduate courses in areas such as nursing and the allied health professions. Nursing is of particular importance due to government targets of recruiting 50,000 more nurses by 2024. So there are three main cycles starting each year, leading to application deadlines in January, June, and October. These are January is the main application deadline for UCAS, June is UCAS Extra, and October is clearing. So our brief to DCX was to develop complex campaigns for each of these cycle deadlines, include algorithms that tailor jobs and courses to the individual statuses and location. These each have very tight deadlines, primarily down to the fact that we get campaign spend approval sometimes 6 to 8 weeks before the launch of the campaign, and this comes from the Cabinet Office, and we cannot deliver campaigns or start campaigns until we have this approval. So this crucial work is also often supplemented by other campaigns throughout the year to support our wider objectives, including the recruitment of healthcare support workers and encouraging healthcare professionals to return to practice.
So what were the challenges? There were 4 key challenges that we identified. The first was time taken to develop highly complex journeys using SQL scripts. And as a result of that, there was a high risk of human error. High cost as a result of that development time, which was impacting the client's budgets. and infrequent reporting. We were providing reporting via Excel spreadsheets on a weekly basis, and there wasn't that possibility to interrogate the data and use that as best as possible. So they were our 4 key challenges. And then a look towards a solution. So this is where we were trying to get to. These were the key programs that we were trying to build at the time. And these are the contact strategies for the career switchers specifically and allied health professionals. And within this, there's some real complexity that I wanted to try and bring to life here today. Some of the key points to pull out, there was different rules, and there is different rules for journey entry depending on who you are and how you register, where you register from and what you've registered with. And as a result, that complexity adds a number of different versions of the journeys that became very difficult to do in SQL, but was enhanced using PeopleStage. There's dynamic content within the emails, but also across the emails. If we have roles, for example, with allied health professionals, if you have 2 roles versus 4 roles, you would get a different program. We have fast tracking, the opportunity for people to hand raise and say that they've already applied, and those people too would receive a slightly different communication and a slightly different customer journey. And then we have rules to shift people from one journey to the other, depending on their preferences. And also a great addition and functionality was the condensed versions of these journeys, depending on when they've registered. And with that eye always on the UCAS deadlines that we have to hit, we would either shrink or enlarge their journey depending on the particular time that they registered. And this level of complexity essentially compounded the need for us to move away from SQL coding and approach to building these journeys in a smarter way. The Apteco PeopleStage modular and templatable approach to journey building made implementing this level of complexity far easier. There's around 120 templates and different touch points across this particular program. And this is just a snippet, really. There's a few other journeys as well included within this piece of work. But essentially, this led to drastically shorter lead times to support in issue resolution and response times as well. So whilst we knew it would support with the build, it's also allowed us to react and be more agile if there are issues or any challenges that we face. When we scoped this out, we forecasted a 25% saving in time and cost before the project ran. And actually, upon review, it's probably closer to 33%, which is a fantastic improvement in terms of efficiency across the campaign.
So as well as the benefits that Josh has just mentioned, the reporting dashboards we now can access through Orbit means we have real-time information, near to real-time information on our data, allowing us to not only respond almost immediately to requests from our senior leadership team and from our partners, we can now be much more fleet of foot with our planning, and we'd not have to wait for DCX to supply us with the data that we need. This means we can plan quicker and easier and use the data to inform future campaigns on areas such as the shape and length of the journeys, the messaging, and importantly, the calls to action.
So what? So as we've outlined, we've essentially enhanced the visibility of the SCV. So we were collecting, storing and maintaining that data already, but we didn't have the visibility to be able to really use it in the way that we wanted to. And as a result of that, we've seen increased lead times and development, but also greater reporting access for the client, which Darren mentioned before. We've also seen real improvements in the database maintenance. The latency has been reduced by 86%. The cost of the build times has reduced by 90% on our back-end processes. And as I said before, we've seen up to a 33% reduction in campaign development, effort and cost. And all of this amounts to developing and delivering highly targeted dynamic email communications on behalf of Health Education England to support them in achieving their goals and objectives to recruit more people to the NHS.
So for us, one of the biggest outcomes of our work with DCX has been that since we've been running these campaigns, we have seen significant increases in applications to a number of different NHS roles. As you can see here, we've actually seen a 37% increase in nursing applications in 2022 compared to 2018 when we weren't running these campaigns. And in the allied health professions, which includes a number of different professions such as physiotherapy, radiography, we've actually seen a 40% increase in applications in those same years. pleasingly, what we've seen as well is that actually people on our database telling us that they've applied for these roles. 11,500 of them actually telling us they've applied for these roles, which gives us a real justification for what we're doing. But we think we can build on this, and we really have some ambitions to be able to show the real value of the campaign by matching the data in our database to the application data on UCAS. We can then really see how many of the people we've actually engaged for our campaigns have actually gone on to apply for one of these really crucial courses.
Darren's just taken us through the client outcomes and impact, but did we resolve the 4 key challenges that we set out to resolve at the start of the project? And the short answer is yes, we did. The time taken to develop highly complex journeys was reduced, and as we said before, the risk of human error was greatly reduced as well from developing those complex SQL scripts. As a knock-on effect, the cost has dropped, so the budget impact is greater on Darren, which is brilliant. And the key visibility and the previous lack and infrequent reporting that we had has been enhanced and taken to another level, which is, as Darren outlined for us before, really supported them in answering internal queries, but also driving key decisions within the marketing campaigns that they're working on building. And for us, we're always looking towards the next steps and how can we better use Apteco and that platform to help support our clients' objectives. I think there's some really exciting new opportunities out there, especially with potentially sixth formers and some of the younger audiences that HE engage with, potentially using WhatsApp and SMS. But I also think there's a real opportunity with profiling and modelling, especially with lapsed and churned analysis and helping us to understand that data better and really capitalising on the data that we have. So that's it from us. Thank you very much for listening to our presentation. There's a couple of quotes on screen here of the work that we've done, and we're incredibly proud of the project and working specifically with HE as well. So thank you very much for your time.
And thank you for me as well. Thank you for listening. Hope you enjoyed the presentation.